The obesity epidemic is a very grave concern to, I believe, employers. We have a very strong employee health and wellness program. We're now taking it to employers, but I see more employers interested in what can they do to address this through prevention and wellness, education, employing factors like we're going to do body mass index screening, health questionnaires. We're going to provide weight loss programs for our employees at no cost. If they don't go through the screenings or the questionnaire, then that is a cost to them, and we add on. They don't get that reduction. We have to deal with the cost of health care and how health care is delivered in this country. I've been through a lot of different, quote, healthcare reform initiatives. I go all the way back to Nixon's wage and price sprees. We went through TEFRA, we went through DRGs, we went through the Balanced Budget Act, and now the Affordable Care Act. And in every instance, we've looked at trying to achieve healthcare reform. It really came back to the providers, the hospitals, the health systems, and the physicians to really come up with the innovation and change how they delivered care in order to maximize how we were reimbursed. What I've always believed has been wrong in healthcare as far as the cost is the financing. And I think you're seeing now reform happening by providers, being driven somewhat by employers as well as managed care companies, but to go to a point to where we're not paying for volume, we're truly paying for value. We never did pay for quality and outcomes and really recognize those quality providers and incentivize them. I see that changing. That's going to have to change. Part of our cost is fragmentation. There's a huge cost with lack of standardization. And at Baylor, we are putting all of these levers into place to do more standardization, more order sets, more standard protocols. We're focusing on getting patients into a patient-centered medical home, be it a private physician's office, a clinic, one of our community faith-based clinics, or into the program like we put in Southern Dallas, which was an economically, medically underserved area, with the initiation of the Diabetes Health and Wellness Institute, which is a partnership between the city of Dallas and Baylor. We took over an underutilized recreation center in that community because we saw too many patients come into our emergency department from those zip codes with type 2 diabetes, but it was too late. Losing eyesight, losing limbs, other comorbidities. We completely remodeled it, we expanded it, put in a fitness center, we put in a kitchen for doing cooking demonstrations so people can learn to cook healthy. It's a food desert, so every week we bring in a farmer's market, sell fresh fruits and vegetables at a discounted price so these people will have access to not only healthy cooking, but healthy food that they can take home and cook. We have a physician there now. We go into the homes, we go into the churches. We have community outreach workers to do prevention, to do wellness, to do education, and to get people excited about taking charge of their own health. And the goal is to prevent type 2 diabetes. It's a center of excellence around that specific chronic disease. We have seen in 2 years it's been in operation now, a 40% reduction in our ED visits from that population base.